myself.
Let's just see how it looks. Test, test, test. Sound okay. Testing, testing. Charlie, walk in and show. Let's see how you're supposed to.
Do you want me to be out of the frame for the start?
Yeah.
And just come in when you're ready?
That's okay. All right, that's how you're going to do. Okay, that's your approach to the camera.
Because I don't think I should be. I think I'm distracting sitting there when you first talk. It should just be you and your baby.
Let's go to debrief.
Turn your phone off, Charlie.
Good afternoon. I'm Fred Cecil with Laerdal Medical, and with the help of my children, Laura and Charlie, we are going to discuss this morning Mama Natalie and Baby Natalie. Mama Natalie is Laerdal's answer for the need for a low-cost, highly effective simulator that records normal and complex births. And I think we've really done a great job of this one. I'll start out by going through the basic components of Mama Natalie. You've got the birthing simulator, the primary component here, with the uterus and a blood storage bank. It also has a method for simulating a fundus, for fundal massage. You've got the baby. The baby on its own can simulate chest rise, and it's got a palpable pulse in the umbilicus. You've got a placenta for simulating full and partial placental delivery. You've got a full umbilical cord. The baby's filled with water, which gives it a fairly normal feel as far as the weight goes. You can fill it with tepid water to give it even a semblance of normal warmth for simulation. It also comes with a method for hearing the fetal heart tones, a suction device, a uterine catheter, as well as a method for delivering meds and tying off the umbilicus. So let's go ahead and load the baby in. Let's open the uterus. So the baby, in this particular case, we're going to simulate a normal birth. So the baby, we go in head first, face down. Although you also have the option of simulating a variety of different, more difficult situations, shoulder dystocia, breech birth, any type of positioning situation, a difficult positioning situation that you may want to teach. And we'll place the placenta down. Let's close the uterus. And my daughter Laura today is going to be the delivery specialist. I guess the midwife might be the proper term. So that's really all there is to setting it up as far as the simulated blood goes. The simulated blood is just mixed and poured into this component. We're not going to use simulated blood today because we've got white carpets and I'm at home, and I guess that tells you who's boss around here. So, okay, doctor. Right now, Laura is palpating to feel that the baby's in proper position. What do you feel? Do you feel? Can you feel the head?
Yes.
So everything feels normal.
Yes.
Okay. Now we're going to check the baby's sounds. We're going to check for fetal heart tones just to see how everything sounds. It's a very simple way to do it, but basically the fetal heart tones are demonstrated by tapping on the hard shell plastic for the that contains the blood. So right now the mother is ready to push. So you feel that is the baby crowning?
Yes.
Okay, you may have to help assist a little bit. Is it turning? Okay. All right, it looked like a normal. We kind of left out that 15 hours of labor that we dealt with you. So the baby's out in place. Now what do we have to do? What's the next thing we have to deal with?
We need to give you a shot to control the bleeding before we...
Okay, well, we should probably make sure we're paying attention. I'm not hearing the baby breathe. So go ahead and do that. Okay.
So now we're
I'm going to hand the baby right now to our neonate specialist while we try to deal with the placental. So don't pull too hard. You know, you want to make sure you don't tear anything. So there we are. Here we are. Now what are you doing?
examining to make sure it's intact.
Everything look good?
Mm-hmm.
Okay, so we've got complete intact placental delivery. Okay, so place the baby here. Now what are we going to do?
You need to cut the umbilical cord.
Okay. We're still not hearing it. Let's get the baby going. So the suction, so we're probably a little slow with that, but that's all part of the teaching. All right.
There we go. Congratulations.
That's what we like to hear. So we've got an active crying baby. So
Could you hand me the clamp?
we probably in real life should make it a point to be a little more concerned about the baby breathing quickly and get our priorities in check. So she's tying off the umbilicus right now, separating the umbilicus. And at this point in time, there's a little bit of bleeding. So what do we do now, doctor?
So we need to massage.
Massage. So now we have, you feel the fundus?
Mm-hmm.
So she feels pretty firm?
Yes.
Okay. Now what do you feel? Can you feel a change?
Just a little bit. There it goes.
Okay, so now the fundus is softened and the bleeding is stopped. So basically we've simulated a fairly normal birth process. We may have been off on a few of the specifics, but I think you get the idea. The additional thing that Mama Natalie does, probably a little more along the lines of what you get with a prompt birthing simulator, is you incorporate the human element. You can have a mother that really is fairly mobile if you need to move her around, if she needs to reposition so that gravity can be more of an effective tool in helping with the delivery. Mama Natalie probably does that as well as anything that we've got. So Mama Natalie is a pretty effective teaching tool and incorporates most all the valuable aspects that we try to teach with OB training, and it's certainly a valuable tool for Laerdal, and it's certainly a very elegantly designed product that's got a noble cause, and I'm sure it's going to do very well for us. Thank you. Perfect. Let's see what it looks like.
That was really good.
Okay. I should have been quicker on the pump.
Well, I'm not an expert. Probably in there what they did was as soon as he brought the baby up, the baby started crying. The first thing that we should probably involve with is our priorities. What's the first thing you want to do? Somebody's not breathing, right?
Yeah.
So I should immediately grab the baby and start.
Yeah, if this baby came out and wasn't breathing, normally what you would do, this all happens very quick.
I didn't want to throw you off. I don't want to rip the baby from you.
No,
So
that's
you're
fine.
right.
That's
Your
fine.
instincts.
You know what? And I think this is fine. Let's just see how it looks.
It sounded good.
Yeah, you did well.
It's a pretty cool product, and you know, in all honesty, it's not a bad way to.
Are you going to keep this video? I kind of like to have it.
Yeah, you can. Well, you have to have this software on your computer to play it.
Well, Laura can record it on her phone.
To brief.
On the computer. Do you get video on your phone?